The hormone which increases the sensitivity and secretion of insulin is known as A. Insulin, B. Pituitary hormone, C. Chondroitin, D. Osteocalcin. And the answer is D. Osteocalcin. The hormone which increases the sensitivity and secretion of insulin is known as osteocalcin. Osteoblasts are cells that form bones. Osteoblasts secrete osteocalcin. Osteocalcin acts as a hormone in the body, causing beta cells in the pancreas to release more insulin, and at the same time directs fat cells to release the hormone adiponectin, which increases sensitivity to insulin. Which endocrine gland is situated in the neck? A. Pancreas, B. Adrenal gland, C. Thyroid gland, D. Pituitary gland. And the answer is C. Thyroid gland. The endocrine gland which is situated in the neck is thyroid gland. Thyroid gland is a butterfly-shaped gland located in the neck. Cretinism or dwarfism is caused due to hyposecretion of A. Pancreas, B. Thyroid gland, C. Adrenal gland, D. Thymus gland. And the answer is B. Thyroid gland. Cretinism or dwarfism is caused due to hyposecretion of thyroid gland. Islets of Langerhans is a part of A. Endocrine part of pancreas, B. Exocrine part of pancreas, C. Gonads, D. Pituitary gland. And the answer is A. Endocrine part of pancreas. Islets of Langerhans is a part of endocrine part of pancreas. The endocrine component of the pancreas consists of islets of Langerhans that create and release important hormones directly into the bloodstream. Muscle spasms may occur in the body due to deficiency of A. Thyroxine, B. Parathyroid hormone, C. Testosterone, D. Vasopressin. And the answer is B. Parathyroid hormone. Muscle spasms may occur in the body due to deficiency of parathyroid hormone. Deficiency of parathyroid hormone can cause mild symptoms like tingling in the hands, fingers, and around the mouth. And it can also cause more severe forms of muscle cramps like tetany, that is, severe muscle cramping of the entire body. Alpha and beta cells are found in A. Liver, B. Pancreas, C. Thymus, D. Thyroid gland. And the answer is B. Pancreas. Alpha and beta cells are found in pancreas. Alpha cells produce glucagon, whereas beta cells produce insulin. In the following, which glands secretes tears? A. Sebaceous glands, B. Sweat glands, C. Pituitary gland, D. Lacrimal glands. And the answer is D. Lacrimal glands. The glands which secretes tears are lacrimal glands. The lacrimal gland lies within the orbit of the outer portion of the upper eye. The gland continually secretes tears which moisten, lubricate, and protect the surface of the eye. Excess tears drain into small ducts which empty into the nasal cavity. The hormone responsible for the attachment of embryo to the wall of the uterus is A. Progesterone, B. Estrogen, C. Epinephrine, D. Relaxin. And the answer is A. Progesterone. The hormone responsible for the attachment of embryo to the wall of the uterus is progesterone. Progesterone prepares the tissue lining of the uterus to allow the fertilized egg to attach to the wall of the uterus and helps to maintain the endometrium throughout pregnancy. The gland mainly responsible for calcium homeostasis is A. Thymus gland, B. Thyroid gland, C. Parathyroid gland, D. Adrenal gland. And the answer is C. Parathyroid gland. The gland mainly responsible for calcium homeostasis is parathyroid gland. Cushing's disease is due to excessive stimulation of A. Pituitary gland, B. Adrenal cortex, C. Thyroid gland, D. Adrenal medulla. And the answer is B. Adrenal cortex. Cushing's disease is due to excessive stimulation of adrenal cortex. Situated along the perimeter of the adrenal gland, the adrenal cortex mediates the stress response through the production of mineralocorticoids and glucocorticoids, such as aldosterone and cortisol, respectively. Cushing's disease, a disorder caused by prolonged exposure of the body's tissues to high levels of hormone cortisol. Pituitary disorders can lead to excess release of cortisol from the adrenal glands. The sudden increase in heartbeat during panic situations is due to A. Release of adrenaline, B. Release of growth hormone, C. Release of corticotropin, D. Hypersecretion of thyroid hormone. And the answer is A. Release of adrenaline. The sudden increase in heartbeat during panic situations is due to release of adrenaline. Adrenaline is released in response to a stressful, exciting, dangerous or threatening situation. Adrenaline helps your body react more quickly. It makes the heart beat faster. Insulin is chemically A. Carbohydrate, B. Protein, C. Fat, D. Enzyme. And the answer is B. Protein. Insulin is chemically a protein. Insulin is a protein composed of two chains, an A chain with 21 amino acids and a B chain composed of 30 amino acids, which are linked together by sulfur atoms. Dwarfism is caused due to hyposecretion of A. Pituitary, B. Pancreas, C. Parathyroid, D. Adrenal. And the answer is A. Pituitary gland. Dwarfism is caused due to hyposecretion of pituitary gland. Extreme shortness in humans usually has a hormonal cause, such as growth hormone deficiency, once called pituitary dwarfism. Other causes of dwarfism are spondyloepiphyseal dysplasia congenita, diastrophic dysplasia, pseudoachondroplasia, Noonan syndrome, primordial dwarfism, Turner syndrome, osteogenesis imperfecta, and hypothyroidism. The disease in adult due to hyperactivity of thyroid gland is called A. Exophthalmic goiter, B. Cretinism, C. Hashimoto's disease, D. Gall's disease. And the answer is A. Exophthalmic goiter. The disease in adult caused due to hyperactivity of thyroid gland is exophthalmic goiter. Exophthalmic goiter is also called Graves' disease. Pharmacodynamics is the study of A. What the drug does to the body, B. What the body does to the drug, C. What the body and the drug do to each other, D. Absorption of the drug. And the answer is A. What the drug does to the body. Pharmacodynamics is the branch of pharmacology concerned with the action of drugs on the body or on microorganisms within or on the body. Which drug may cause grey baby syndrome? A. Lasix, B. Chloramphenicol, C. Tetracycline, D. Imipenem. And the answer is B. Chloramphenicol. Grey baby syndrome is caused by the drug chloramphenicol. The toxicity of the antibiotic chloramphenicol in the newborn, especially the premature newborn, causes grey baby syndrome as their liver lack the necessary enzymes to metabolize the drug chloramphenicol. Symptoms of grey baby syndrome are grey color of the skin, low blood pressure, hypothermia, green stools, irregular heartbeat, difficulty breathing, abdominal distension, and vomiting. In the following, which medicine is used to treat allergic conditions? A. Dexona, B. Cetirizine, C. Chlorpheniramine, D. All the above. And the answer is D. All the above. All the three medications, Dexona, Cetirizine, and Chlorpheniramine, are used to treat allergic conditions. Selective serotonin reuptake inhibitors belong to which category of psychotropic drugs? A. Antipsychotics, B. Mood stabilizers, C. Antidepressants, D. Hypnotics. And the answer is C. Antidepressants. Selective serotonin reuptake inhibitors are a class of drugs that are typically used as antidepressants. They are used in the treatment of major depressive disorder and anxiety disorders. During hemodialysis, which of the following drug is used to prevent blood from clotting? A. Aspirin, B. Heparin, C. Warfarin, D. Protamine. And the answer is B. Heparin. Heparin is used during hemodialysis to prevent blood from clotting. Which of the following is used as an antidote for organophosphorus poisoning? A. Atropine, B. Avil, C. Adrenaline, D. Amiodarone. And the answer is A. Atropine. Atropine is used as an antidote for organophosphorus poisoning. Enalapril is used in the treatment of A. Hypertension, B. Hypotension, C. Heart failure, D. Both A and C. And the answer is D. Both A and C. Enalapril is used in the treatment of both hypertension and heart failure. In the following, which drug is used to prevent and treat HIV/AIDS? A. Zidovudine, B. Ampicillin, C. Dexamethasone, D. Streptomycin. And the answer is A. Zidovudine. Zidovudine is the drug which is used to prevent and treat HIV/AIDS. Zidovudine, also known as azithromycin, is an antiretroviral medication used to prevent and treat HIV/AIDS. It is generally recommended for use with other antiretrovirals. It may be used to prevent mother-to-child spread during birth or after a needle stick injury or other potential exposure. The following drug is a typical antipsychotic medication. A. Ampicillin, B. Valproic acid, C. Quinidine sulfate, D. Haloperidol. And the answer is D. Haloperidol. Haloperidol is the drug which is a typical antipsychotic medication. Haloperidol is a typical antipsychotic medication which is used in the treatment of schizophrenia, tics in Tourette syndrome, mania in bipolar disorder, nausea and vomiting, delirium, agitation, acute psychosis, and hallucinations in alcohol withdrawal. When intravenous heparin therapy is ordered for a patient, while implementing this order, a nurse ensures that which of the following medication is readily available? A. Vitamin K, B. Aminocaproic acid, C. Potassium chloride, D. Protamine sulfate. And the answer is D. Protamine sulfate. As protamine sulfate is an antidote for heparin overdose in the event of bleeding, protamine sulfate is given to stop bleeding. Antidote for streptokinase is A. Protamine sulfate, B. Aminocaproic acid, C. Naloxone, D. Vitamin K. And the answer is B. Aminocaproic acid. Aminocaproic acid is the antidote for streptokinase. Streptokinase is used immediately after symptoms of a heart attack occur to improve patient survival. It is also used to treat blood clots in the lungs, that is pulmonary embolism, and blood clots in the legs, that is deep vein thrombosis. The drug of choice in filariasis is A. Mebendazole, B. Albendazole, C. Diethyl carbamazine, D. Piperazine. And the answer is C. Diethyl carbamazine. Diethyl carbamazine is the drug of choice in filariasis. Diethyl carbamazine is the drug of choice for treatment of lymphatic filariasis caused by the parasites Wuchereria bancrofti, Brugia malayi, and of Lovovice caused by the filarial parasite Lova lova. A patient was on anti-tubercular regimen. He consults a physician and complains of visual impairment and color blindness. The drug responsible for this adverse effect could be A. Rifampicin, B. Ethambutol, C. Isoniazid, D. Streptomycin. And the answer is B. Ethambutol. The most important complication of ethambutol therapy is retrobulbar neuritis, manifested by impaired visual acuity, color blindness, and restricted visual fields. Digoxin is used in A. Congestive heart failure, B. Angina pectoris, C. Hypertension, D. Shock. And the answer is A. Congestive heart failure. Digoxin is used to treat congestive heart failure, usually along with other medications. It is also used to treat certain types of irregular heartbeats, such as chronic atrial fibrillation. Treating heart failure may help maintain your ability to walk and exercise, and may improve the strength of your heart. Mebendazole is used in A. Amoebiasis, B. Malaria, C. Filariasis, D. Pinworm. And the answer is D. Pinworm. Mebendazole is used to treat intestinal worm infections such as pinworm, roundworm, and hookworm. Identify the following procedure: A. Thoracentesis, B. Endoscopy, C. Colonoscopy, D. Spinal fluid analysis. And the answer is A. Thoracentesis. Thoracentesis is also known as thoracocentesis or pleural tap. Pleural space is present between the lungs and chest wall. If there is excess fluid in the pleural space, it can compress the lungs and cause difficulty breathing. In thoracocentesis, a needle or cannula is carefully introduced into the pleural space to drain the excess accumulated fluid and thereby making it easier for you to breathe again. Name the following instrument. A. Sponge holding forceps. B. Magill forceps. C. Needle holder. D. Chittle forceps. And the answer is B. Magill forceps. Magill forceps are angled forceps used to guide a tracheal tube into the larynx or a nasogastric tube into the esophagus under direct vision. They are also used to remove foreign bodies. Name the following procedure. A. Thoracentesis. B. Endoscopy. C. Lumbar puncture. D. Central line insertion. And the answer is C. Lumbar puncture. A lumbar puncture is also called spinal tap. It is performed in your lower back in the lumbar region. During a lumbar puncture, a needle is inserted between the two lumbar bones to remove a sample of cerebrospinal fluid. This is the fluid that surrounds your brain and spinal cord to protect them from injury. The main reason for a lumbar puncture is to help diagnose diseases of the central nervous system, including the brain and spine. Identify the device shown below. A. Endotracheal tube. B. Laryngoscope. C. Oxygen face mask. D. AMBU. And the answer is D. AMBU. AMBU stands for Air Mask Bag Unit or Artificial Manual Breathing Unit. AMBU is a handheld device commonly used to provide positive pressure ventilation to patients who are not breathing or not breathing adequately. Identify the machine. A. Mechanical ventilator. B. Dialysis machine. C. Ultrasound machine. D. Phototherapy machine. And the answer is B. Dialysis machine. Dialysis machine removes excess water, solutes and toxins from blood in people whose kidneys can no longer perform these functions naturally. This is referred to as renal replacement therapy. Identify the equipment below. A. Endotracheal tube. B. Laryngeal mask airway. C. AMBU. D. Laryngoscope. And the answer is A. Endotracheal tube. The endotracheal tube is a plastic tube which is placed into the trachea. The primary purpose of endotracheal tube is establishing and maintaining a clear airway and to ensure adequate exchange of oxygen and carbon dioxide. Name the instrument shown below. A. Chittle forceps. B. Speculum. C. Retractor. D. Thumb forceps. And the answer is A. Chittle forceps. Chittle forceps is also called Chittle sterilizer forceps. Chittle sterilizer forceps are used to remove sterilized instruments from boilers and formalin cabinets. They are used to ensure that as each item is removed, others are not infected. The forceps are placed in a container of methylated spirits when not in use. Identify the machine shown below. A. Syringe pump. B. Blood warmer. C. Infusion pump. D. DVT pump. And the answer is C. Infusion pump. An infusion pump is a medical device that delivers fluids such as nutrients and medications into a patient's body in controlled amounts. By using normal IV drip, the flow rate cannot be controlled. But by using infusion pump, the flow rate can be controlled as per requirement. Name the device in the image below. A. Syringe pump. B. Blood warmer. C. Infusion pump. D. DVT pump. And the answer is A. Syringe pump. Syringe pump is also called syringe driver. Syringe pump is a small infusion pump used to gradually administer small amounts of fluid to a patient. Identify the equipment below. A. Endotracheal tube. B. Ryle's tube. C. Tracheostomy tube. D. Feeding tube. And the answer is C. Tracheostomy tube. A tracheostomy tube is a curved tube that is inserted into the tracheostomy stoma, that is, the hole made in the neck and windpipe. Name the device below. A. Laryngeal mask airway. B. Oropharyngeal airway. C. Bronchoscope. D. CVP manometer. And the answer is A. Laryngeal mask airway. Laryngeal mask airway is composed of an airway tube that connects to an elliptical mask with a cuff which is inserted through the patient's mouth down the windpipe. Once placed inside, forms an airtight seal on the top of the glottis, unlike tracheal tubes which pass through the glottis, allowing a secure airway to be managed by a healthcare provider. Identify the device given below. A. Cuff manometer. B. Sphygmomanometer. C. Pulse oximeter. D. Thermometer. And the answer is C. Pulse oximeter. A pulse oximeter is a small, lightweight device used to monitor the amount of oxygen carried in the body. This non-invasive tool attaches painlessly to the fingertip, sending two wavelengths of light through the finger to measure your pulse rate and how much oxygen is in your system. Recognize the device given below. A. Bronchoscope. B. Cystoscope. C. Ophthalmoscope. D. Laryngoscope. And the answer is C. Ophthalmoscope. Ophthalmoscope is used to see the retina, the optic disc and blood vessels of the eye. It helps to check for diseases and other eye problems. It can be done as part of an eye examination and may be done as part of a routine physical examination. Name the equipment shown below. A. ECG machine. B. Suction machine. C. Ultrasound machine. D. X-ray machine. And the answer is B. Suction machine. Suctioning machine may be used to clear the airway of blood, saliva, vomit or other secretions so that the patient may breathe. Suctioning can prevent pulmonary aspiration, which can lead to lung infections. In pulmonary hygiene, suction is used to remove fluids from the airways to facilitate breathing and prevent growth of microorganisms. Identify the type of ventilation used in the image given below. A. Non-invasive mechanical ventilation. B. Invasive mechanical ventilation. C. Tracheostomy. D. Artificial manual breathing unit. And the answer is A. Non-invasive mechanical ventilation. Non-invasive mechanical ventilation is the technique of delivering mechanical ventilation without endotracheal intubation or tracheostomy, and thus avoiding the complications which can be caused due to endotracheal intubation or tracheostomy. Identify the device shown in the image below. A. Gyroscope. B. Ophthalmoscope. C. Laryngoscope. D. Bronchoscope. And the answer is C. Laryngoscope. The prefix laryngo means larynx, and the suffix scope means any instrument used to view or observe. Laryngoscope is used to view larynx, a part of the throat, to view, for example, vocal folds and the glottis. Laryngoscope helps in endotracheal intubation and also in visualizing larynx during other procedures. A patient had a total thyroidectomy yesterday. The patient is complaining of tingling around the mouth and in the fingers and toes. What would the nurse's next action be? A. Obtain a crash cart. B. Check the calcium level. C. Assess the dressing for drainage. D. Assess the blood pressure for hypertension. And the correct answer is B. Check the calcium level. During total thyroidectomy, that is total surgical removal of thyroid gland, damage can occur to parathyroid glands which are located on the thyroid gland. Your calcium levels can drop below normal as a result of the surgery because parathyroid glands regulate calcium levels in your blood. Hence, calcium levels should be monitored after thyroidectomy. Which of the following nursing diagnosis would be most appropriate for a patient with an intestinal obstruction? A. Chronic pain related to abdominal distension. B. Fluid volume deficit related to nausea and vomiting. C. Urinary retention related to fluid volume deficit. D. Impaired swallowing related to NPO status, nothing per oral status. And the correct answer is B. Fluid volume deficit related to nausea and vomiting. Fluid volume deficit is a dangerous complication of intestinal obstruction which can lead to organ failure, shock and death. Treating dehydration is important. IV fluids may be started to correct electrolyte imbalance. A nurse notes that the physician has documented a diagnosis of presbycusis on a patient's chart. She plans care knowing the condition is A. Nystagmus that occurs with aging. B. Tinnitus that occurs with aging. C. A sensorineural hearing loss that occurs with aging. D. A conductive hearing loss that occurs with aging. And the correct answer is C. A sensorineural hearing loss that occurs with aging. Presbycusis is the loss of hearing that gradually occurs in most individuals as they grow older. Hearing loss is a common disorder associated with aging. The primary reason for infusing blood at a rate of 60 ml per hour is to help prevent which of the following complications? A. Allergic reaction. B. Red blood cell hemolysis. C. Fluid volume overload. D. Emboli formation. And the correct answer is C. Fluid volume overload. When too much blood is transfused too quickly into a person, it can cause acute left ventricular failure, which is also called transfusion-associated circulatory overload. A nurse has been assigned to a patient with Buerger's disease. Which of the following anatomic areas are most often affected by this vascular condition? A. Lower back. B. Head and neck. C. Chest. D. Hands and feet. And the correct answer is D. Hands and feet. Buerger's disease or Buerger's disease is also called thromboangiitis obliterans. In Buerger's disease, your blood vessels swell and can become blocked with blood clots, that is, thrombi. This eventually damages or destroys skin tissues and may lead to infection and gangrene. Buerger's disease usually first shows in the hands and feet and may expand to affect larger areas of your arms and legs. A patient is suspected of having systemic lupus erythematosus. The nurse monitors the patient knowing that which of the following is one of the initial characteristic signs of systemic lupus erythematosus. A. Lupus nephritis. B. Weight gain. C. Rash on the face across the bridge of the nose and on the cheeks. D. Elevated RBC count. And the correct answer is C. Rash on the face across the bridge of the nose and on the cheeks. Systemic lupus erythematosus is an autoimmune disease. In this disease, the immune system of the body mistakenly attacks healthy tissue. It can affect the skin, joints, kidneys, brain, and other organs. A patient has been admitted to the hospital with the diagnosis of acute pancreatitis, and a nurse is assessing this patient's pain. What type of pain is consistent with this diagnosis? A. Severe and unrelenting pain located in the epigastric area and radiating to the back. B. Burning and aching pain located in the left lower quadrant and radiating to the hip. C. Severe and unrelenting pain located in the left lower quadrant and radiating to the groin. D. Burning and aching pain located in the epigastric area and radiating to the umbilicus. And the correct answer is A. Severe and unrelenting pain located in the epigastric area and radiating to the back. In acute pancreatitis, the pain in the upper abdomen radiates into the back. The pain usually increases by eating, especially foods high in fat. A nurse is providing instructions to a patient with breast cancer who is receiving cyclophosphamide. The appropriate advice is to A. Increase fluid intake to 2000 to 3000 ml daily. B. Take the medication with food. C. Increase potassium intake while taking the medication. D. Decrease sodium intake while taking the medication. And the correct answer is A. Increase fluid intake to 2000 to 3000 ml daily. Increasing the fluid intake while receiving cyclophosphamide prevents harmful effects on the patient's bladder. An emergency department nurse is assessing a patient who has sustained a blunt injury to the chest wall. Which of these signs would indicate the presence of a pneumothorax in this patient? A. Diminished breath sounds. B. A low respiratory rate. C. A sucking sound at the site of injury. D. The presence of a barrel chest. And the correct answer is A. Diminished breath sounds. Pleural space is present between the lungs and chest wall. The presence of air or gas in the cavity between the lungs and the chest wall causing collapse of the lung is called pneumothorax. As the chest expansion is significantly decreased on the side of the pneumothorax, breath sounds are dramatically decreased due to decreased ventilation on the side of pneumothorax. A nurse is reviewing the history of a patient with bladder cancer. She expects to note documentation of which most common symptom of this type of cancer. A. Hematuria. B. Dysuria. C. Frequency of urination. D. Urgency of urination. And the correct answer is A. Hematuria. Hematuria, that is blood in urine with no pain, is the most common symptom of bladder cancer. Nodes of Ranvier are found in. The correct answer is C. Axon. Nodes of Ranvier are also known as myelin sheath gaps. Nodes of RANVR helps in the rapid conduction of nerve impulses. Conversion of glucose to glycogen is termed as. The correct answer is D. Glycogenesis. Which gland plays a vital role in responding to stress? The correct answer is A. Adrenal gland. Adrenal gland produces adrenaline and cortisol, hormones that determine how your body responds to stress. Canal of Slem is found in. The correct answer is D. Human eye. Schlem's canal is a unique vascular structure that functions to maintain fluid homeostasis by draining aqueous humor from the eye into the systemic circulation. Total number of semicircular canals are. The correct answer is C. 3. Semicircular canals are 3 tiny fluid-filled tubes in your inner ear that help you keep your balance. The space between the vocal cords is known as. The correct answer is D. Glottis. The outermost layer of blood vessel is. The correct answer is B. Tunica adventitia. Tunica adventitia is also known as tunica externa. Baroreceptors are related to. The correct answer is D. Maintaining blood pressure. Total period of one cardiac cycle is. The correct answer is B. 0.8 seconds. Which artery supplies the pancreas? The correct answer is D. Splenic artery. Hormone renin is produced by. The correct answer is D. Kidney. Kupffer cells are found in. The correct answer is B. Liver. Bile is produced by which organ? The correct answer is D. Liver. Bile is stored in which organ? The correct answer is A. Gallbladder. Alimentary tract terminates at. The correct answer is D. Anus. The amount of gastric juice secreted daily is. The correct answer is C. 1.5 liters. Villi are responsible for. The correct answer is A. Increasing surface area of small intestine. Which is the largest and most muscular chamber of the heart? The correct answer is D. Left ventricle. How many salivary glands do humans have? The correct answer is C. 3 pairs. The organ which produces erythropoietin hormone is. The correct answer is D. Kidney. Suppuration means. The correct answer is B. Pus formation. Adipocytes are. The correct answer is D. Fat cells. Haversian canals are found in. The correct answer is B. Bone. The part of sperm which is packed with mitochondria. The correct answer is B. Midpiece. Total number of blood clotting factors are. The correct answer is C. 13. Which gland can be classified as both an endocrine and exocrine gland? The correct answer is D. Pancreas. The junction through which neurons communicate with one another is. The correct answer is C. Synapse. Heat regulating center is located in. The correct answer is C. Hypothalamus. Most frequently fractured carpal bone is. The correct answer is D. Scaphoid. Transformation of one type of cell into another type is called. The correct answer is C. Metaplasia. The only movable joint of the skull is. The correct answer is D. Temporomandibular. First bone of the vertebral column is. The correct answer is B. Atlas. Cardiac muscles are. The correct answer is D. Involuntary and striated. Enzyme which helps in digestion of fat is. The correct answer is B. Lipase. Nerve which helps in the process of smelling is. The correct answer is D. Olfactory nerve. The difference between systolic pressure and diastolic pressure is. The correct answer is D. Pulse pressure. The artery which supply blood to head and neck is. The correct answer is C. Carotid artery. In human body, glycogen is mainly stored in. The correct answer is B. Liver. Total number of muscles in human body are. The correct answer is A. 600 muscles. There are over 600 skeletal muscles within the typical human body. Kidneys are situated in. The correct answer is B. Abdominal cavity. Smallest form of vein is known as. The correct answer is A. Venule. A venule is a very small blood vessel in the microcirculation that allows blood to return from the capillary beds to drain into the larger blood vessels, the veins. Which bone is also known as shin bone? The correct answer is A. Tibia. The cavity in which scapula make shoulder joint with humerus is. The correct answer is B. Glenoid. Which of the following organs is also known as neck of the uterus? The correct answer is B. Cervix. Blood groups were first discovered by. The correct answer is B. Karl Landsteiner. Sinoatrial node is located in which part of the heart? The correct answer is B. Right atrium. Male gonads are. The correct answer is A. Testis. Opening of the hepatopancreatic duct into duodenum is guarded by. The correct answer is C. Sphincter of Oddi. Sphincter of Oddi is also called hepatopancreatic sphincter or Gleason sphincter. Gastric juice consists of except. The correct answer is C. Trypsin. Gastric juice is the digestive liquid secreted by the glands of the stomach, is a thin, colorless, acidic liquid containing primarily hydrochloric acid, pepsinogen and intrinsic factor plus mucus. Pepsin is responsible for the digestion of? The correct answer is B. Protein. Pepsin is produced in the stomach and is the main digestive enzymes in the digestive systems of humans, where it helps digest the proteins in food. Who is the father of nutrition? A. Anton Lavoisier, B. Hippocrates, C. Aristotle, D. Robert Koch. And the correct answer is A. Anton Lavoisier. Iron is mostly absorbed in A. Stomach, B. Small intestine, C. Colon, D. Kidney. And the correct answer is B. Small intestine. Lactose is made up of A. Sucrose, B. Glucose, C. Galactose, D. Both B and C. And the correct answer is D. Both B and C. Lactose is made up of both glucose and galactose. Fats and oils are A. Compound lipids, B. Derived lipids, C. Simple lipids, D. Steroids. And the correct answer is C. Simple lipids. Fats and oils are simple lipids. The storage form of iron is A. Heme proteins, B. Cytochromes, C. Ferritin or hemosiderin, D. All of these. And the correct answer is C. Ferritin or hemosiderin. Iron is mostly stored in the liver as ferritin or hemosiderin. In the following, which is not a trace element? A. Zinc, B. Iodine, C. Fluorine, D. Sodium. And the correct answer is D. Sodium. Trace elements, that is microminerals, are essential minerals found in minute amounts. Each makes up less than 0.005% of body weight. Trace elements include iron, manganese, copper, iodine, cobalt, zinc, fluorine, selenium, chromium. Milk is a very poor source of A. Protein, B. Phosphorus, C. Iron, D. Calcium. And the correct answer is C. Iron. Which of the following vitamin functions like a steroid hormone? A. Vitamin A, B. Vitamin B1, C. Vitamin C, D. Vitamin D. And the correct answer is D. Vitamin D. When one or more nutrients are added to the food, this is known as A. Food adulteration, B. Food fortification, C. Food contamination, D. Food abstraction. And the correct answer is B. Food fortification. According to who, the process whereby nutrients are added to the foods in relatively small quantities to maintain or improve the quality of diet of a group, a community or a population is called food fortification. The vitamin essential for normal vision is A. Vitamin D, B. Vitamin K, C. Vitamin C, D. Vitamin A. And the correct answer is D. Vitamin A. The nutrient essential for bodybuilding, repair and maintenance of body tissue is A. Protein, B. Fat, C. Carbohydrate, D. Vitamin. And the correct answer is A. Protein. Wernicke encephalopathy and Korsakoff syndrome occurs due to deficiency of A. Vitamin B12, B. Vitamin B2, C. Vitamin B1, D. Niacin. And the correct answer is C. Vitamin B1. The disease which is characterized by 3 Ds is A. Pellagra, B. Marasmus, C. Meningitis, D. Scurvy. And the correct answer is A. Pellagra. Pellagra is caused by the deficiency of niacin. Pellagra is characterized by 3 Ds: diarrhea, dermatitis and dementia. How much extra proteins is required for a lactating woman in addition to recommended daily allowance of 1 gram per kg of body weight? A. 12 grams, B 15 grams, C 25 grams, D 50 grams. And the correct answer is C 25 grams. Which deficiency disease is also known as rice eater's disease? A. Beriberi, B. Scurvy, C. Rickets, D. Pellagra. And the correct answer is A. Beriberi. Vitamin generally used therapeutically in nausea and vomiting of pregnancy is A. Niacin, B. Pyridoxine, C. Riboflavin, D. Folic acid. And the correct answer is B. Pyridoxine. Cooking the food below the boiling point of water is known as A. Boiling, B. Simmering, C. Roasting, D. Baking. And the correct answer is B. Simmering. One of the following is not a millet. A. Jawar, B. Lentil, C. Ragi, D. Bajra. And the correct answer is B. Lentil. Government of India adopted National Nutrition Policy in the year A. 1995, B. 1987, C. 1993, D. 1992. And the correct answer is C. 1993. A man whose body mass index is 22, he is A. Overweight, B. Underweight, C. Normal, D. Obese. And the correct answer is C. Normal. Ascorbic acid is A. Protein, B. Lipid, C. Vitamin, D. Enzyme. And the correct answer is C. Vitamin. Poor man's meat is known as A. Wheat, B. Cereal, C. Pulses, D. Maize. And the correct answer is C. Pulses.